This afternoon, we released our report on healthcare productivity. I'm here with Joe Ascroft, our in-house economist and the author of that report, to talk through some of the issues in our current system and some of the changes we should be implementing. So, Joe, what actually is the concept of healthcare productivity, and what is it about the current model that makes New Zealand's healthcare system so inefficient?
So healthcare productivity is just a measure of how much output we get for a given set of inputs. So how many surgeries, how much hospital treatment, how much care people are getting for, the amount of resources we put in, the nurses, the doctors, the amount of money we spend on our hospital system to achieve those outcomes. People take a variety of different views as to why healthcare productivity has been so weak in New Zealand over the last 15 or 20 years. There are the kinds of free market people who think that the state's dominance in the healthcare sector is really to blame. So Bryce Wilkinson from New Zealand Initiative wrote a report where he argues that it's the state dominance in the sector that explains why healthcare productivity has been so weak. Basically arguing that the lack of competition, the inability to reallocate resources particularly effectively really damages that healthcare productivity growth. Patrick Nolan from the Productivity Commission argues a subtly different point that while the state sector can still innovate, it doesn't have that same reallocative ability that the private sector has. When the private sector is failing or not growing or being productive, it can swiftly reallocate capital and labour to become more effective, whereas the state sector often gets bogged down in bureaucracy, political decision-making, and that can be, bad for achieving productivity growth. The OECD take a subtly different view. So they argue that it doesn't matter so much what kind of healthcare system you have. You could have a, say, German-style social insurance scheme. You could have a British-style socialised system, similar to what we have here. Or you could have a private market-driven system like, say, the United States or Singapore. Really, it's about what you make of the system that you have. So they, in a 2010 report, they looked at our healthcare system and said that, we seem to have a lot of back office bureaucracy, administrative costs that were burdening our system. And we kind of looked to that as the inspiration for both our healthcare report and our subsequent issues papers looking at potential efficiencies at DHBs.
So in your report, you've suggested that without making some changes, we're inevitably going to have to raise taxes and increase national debt. So no one here wants higher taxes. But what's wrong with taking out more debt to pay for something so fundamental as healthcare?
I think it's the sheer amount of debt. So the media and politicians often point to superannuation as a big threat looming on the horizon, that superannuation costs are expected to grow significantly as the population ages and are inevitably going to put us under a lot of pressure. I think it's important to not underestimate the level of pressure that we're under looking forward. So Treasury in their long-term fiscal statement in 2016 indicated that debt was forecast at 205.8% of GDP by 2060. That's a lot of debt. And people should not underestimate the effect that would have on the country. Greece right now is sitting at about 180% debt to GDP, and their economy is frankly a basket case, and they've needed multiple bailouts from European Union, IMF, that kind of thing. 205.8% of debt to GDP means we can't afford to pay for education, healthcare, pensions, on top of what else we need to do in terms of foreign affairs, the police, the court system. It puts our budget under a huge amount of stress. And I mentioned earlier that people get worried about superannuation. Healthcare costs are actually expected to grow at a faster rate than superannuation costs over the next 45 years. Now, people don't talk about that a lot, but it's actually going to put an enormous amount of pressure on the budget, even more so than superannuation costs. So it's time we had a conversation about how we can limit that cost growth. And that's why we're focused on healthcare productivity growth. If we can improve the amount of output that we're getting for a fixed amount of inputs, get more surgeries, more hospital treatment with the same or reduced spend, that would significantly improve our ability to handle that debt burden over the next 45, 50 years.
So in that case, what solution are you suggesting?
Well, we think we shouldn't throw the baby out with the bathwater, and that is We don't see a lot of merit in moving to, say, an American-style privatized healthcare system, or even moving to a heavily Singaporean system. We very much view that the OECD is right when saying that we should look to reform, innovate, and improve incrementally within our existing system. So that looks like a few different things in our view. The first thing is that there could be significant merit in amalgamating DHBs. We have a lot of DHBs for the population. I think we have 20 DHBs or something like that for a country of 4 million people or 5 million people. It simply doesn't make sense. We have DHBs like South Canterbury District Health Bed in Tairāwhiti near Gisborne, serving quite small populations. Each DHB has to have presumably a legal team, a communications team, back office staff, bureaucracy, administrative burden. If we can amalgamate some of those DHBs and run those as shared systems rather than having duplicate administrative systems across the board, that could cut down on some of the costs. A few other things we could do to align incentives a little bit better. So right now, we impose a pretty heavy burden on local democracy to elect local board members. And to some degree, there's merit in that. It's nice that people can have a say in their local district health board and feel like they have a stake in the local health sector. That's great. But local media and local politics is not what it once was. And the ability for people to be able to hold those DHBs accountable isn't what it once was. So we recommend that we think the minister should probably have a little bit more control, a little bit more say in nominating board members and appointing board members to each DHB. So if the minister could have, say, at least a majority of DHBs being appointed by them, we think that could give central government a little bit more control, have a little bit more accountability over each DHB. We think that could make quite a lot of difference. People will be able to hold the minister account. People can hold the government to account for the local health outcomes, but frankly, most people don't know the names of their local DHB board members, let alone whether they're doing a good job, whether DHBs are performing or not.
But realistically, Joe, isn't it somebody's job to think all of this through? Are you really suggesting that the government is just turning a blind eye to our lack of productivity in healthcare?
Well, I think it comes back to the point I was just making then. The government isn't necessarily turning a blind eye to it. Right now, a lot of the time, it's simply not their job. A lot of the time we impose the responsibility on DHBs to manage themselves. When if the minister was a little bit more accountable, if the minister could appoint local board members, that would give them a little bit more ability to have some control over the local system. The minister's done a good job to call in a commissioners at Waikato DHB. That was a good, responsible decision to handle a DHB that was not performing well and it was financially underwater. And it's good that Health Minister David Clark has basically threatened DHBs that if they don't sort out their financial situation, he will come in and intervene there as well. But it's a shame that it has to wait till the last moment, and it's a shame that we have to wait until commissioners are being pulled in by the minister to get some decent change. If we give the minister a little bit more control, make them a little bit more accountable for decisions happening on the ground, I think that'd be a really good way of aligning the incentives out, making sure that DHBs perform better.
But measures like tying board remuneration to revenue and encouraging individuals to spend their KiwiSaver funds on private services, isn't that a little bit evil? Shouldn't New Zealand provide decent healthcare to everyone, regardless of whether that's a sound investment?
I'll handle the KiwiSaver point firstly. So in the report, we make a soft recommendation that it would be good if people could perhaps use some of their KiwiSaver funds that they have to purchase private health insurance. It's potentially good for the system in a couple of key ways. Firstly, there are a lot of people right now who would potentially consider getting private health insurance, because there are lots of benefits from private health insurance. You can often get better, faster care, but on the margins, it doesn't make sense for them. Maybe they just don't have the money available to them at that point in time. Maybe they'd rather spend their money on other things. We think it would be nice if they could access some of their KiwiSaver money and take advantage of those systems, because obviously if we're being able to pull some people off the public sector role, move them onto the private care, that's able to cut down on the waiting lists, able to cut down the waiting times and reduce some of the pressure on the public system. And that's good because, if your grandma's waiting for a hip replacement, that kind of thing, the line's a little bit shorter, there's a little bit less pressure. So that could be quite good. The other thing is that if we have a few more people using the private system rather than the public system, we're able to create some of those competitive pressures that Wilkinson was talking about and that the Productivity Commission was talking about that currently don't apply so much on the public system. So if more people are using the private system, we can point to their successes, those efficiencies as kind of a benchmark for the public system. Encourage a little bit more competition and a little bit more accountability for the public sector. So it's good in that regard. On remuneration, you know what? If boards are failing, it should totally be up to the government to cut their pay, dock their remuneration. If they're paid nothing, so be it. We should hold local board members accountable. But the reverse is also true. If DHBs are performing an excellent job, and very few are right now, the DHP system is failing across the board, then they should be able to be remunerated properly. But because they're performing a really important function to be able to provide good quality healthcare to local people at reasonable prices, if they can do that, as the Taxpayers Union, we're totally on board with making sure they are remunerated properly, maybe even paid a bonus, because that matters more than giving them, poor remuneration, poor salaries, or what have you.
Should healthcare be about profit?
It's not about healthcare being about profit. It's about first examining what we want out of our healthcare system and then looking at the best way to achieve those goals. So what do we want out of our healthcare system? Basically two things. One, we want high quality care that people can rely on when they need it. But then the second thing is that we want that healthcare system to be affordable, effective, and efficient. So it would be a disaster if we were, so stubborn that we let keeping the current healthcare system to cause us to have, 200% of GDP debt levels heading up to 2060. That would be a travesty. So to some degree, if we want to use more of the private market in our healthcare system, some people might argue that healthcare should never be about profit. We'd argue that if we can meet those two goals and have a blend of the public and private sector in our healthcare system, then that would be a huge victory.
Great. Thank you, Joe.
Excellent. Thank you.